Now, after having dealt with the anatomy of the lens in our previous videos, if you are watching the videos in the order that I'm uploading them in, you should have been familiarized to the anatomy of the lens. Now, we move on to the most important pathology of lens in our eyes, that is cataract. Now, I think no matter which country you are from, no matter which region you are from, if you have met an old person, if you have a somewhat elderly person in your family, then you must know what cataract is, because I think everybody in their lifetime develops cataract in their eyes after a certain age. Okay, so what exactly is cataract? Cataract, as I had mentioned in my previous video as well, very simply, cataract means any opacity in the lens or its capsule. Now, you might, if you are familiarized with the anatomy of the lens, that is, you might have this question as to why am I separating lens and its capsule as separate parts? Because the capsule of the lens is a part of the lens as well. Why am I saying in lens or its capsule? I could just say in lens, and that would include the capsule as well. I have this question as well, but in every standard textbook of ophthalmology, including my own ophthalmology professor, has mentioned that this is the norm of defining it. So even I am not really aware of why this is the definition, but it is what it is. If you know this, maybe you can let me know in the comments below. It would be very helpful. Anyways, getting back to the video. So any opacity in the lens or its capsule is known as cataract. Now, if opacification develops in the lens, what it will lead to? It will lead to very, very painless, gradual loss of vision. Pay close attention to the adjectives that I've used here. Painless, gradual loss of vision. The cataract developing in eyes, the clues that we are getting, the information that we are getting from this very statement is that it is painless, first of all. That is, there are many conditions in the eye that we'll see consequently in our next videos on different pathologies of the eye, where it is very painful. Mainly many infections and inflammations, they are painful, and they can also lead to loss of vision. Cataract, however, is one such condition where the loss of vision is there, but it is painless and it is very gradual. So you will not have a patient coming to you and saying that my vision was completely okay yesterday, but now suddenly I cannot see. And you investigate that person and you find that it's cataract. That is not how cataract develops. Cataract develops gradually over time, and that is why cataract is very much seen in the elderly population. Okay. So now, what exactly do I mean by loss of vision? By the way, this loss of vision is a very vague term, is it? Because loss of vision, does that mean complete blindness? What exactly does that mean? So actually, there is a definition for visual impairment or blindness that has been given by the World Health Organization. If I can just quickly write the definition down, then it will be very much clearer to you what I mean by loss of vision. So, according to the World Health Organization, blindness is defined as visual acuity. The visual acuity lesser than 3/60 in the better eye. Let me first complete the definition and then I'll explain it. Visual acuity of less than 3/60 in the better eye with best possible correction. With best possible correction. This is the definition for visual impairment or blindness, actually. So what exactly, actually this definition will be a lot clearer to you once we talk about optics. Okay, optics is a huge topic within ophthalmology, and we'll be dealing with that. Basically, it will deal with how our eyes work. Okay, so visual acuity and the different tests for checking visual acuity and all of that will be discussed over there. But basically, visual acuity of less than 3/60 in the better eye with best possible correction. So even after best possible correction, the visual acuity remains less than 3/60. What does 3/60 mean? Let me very quickly give you an explanation for what this 3/60 means, but we'll actually talk about this in a lot more detail when we'll talk about optics, as I just mentioned. So basically we have this test called Snellen's test, or rather Snellen's chart, that we use, and you might have seen this. In fact, I'm pretty sure that if you have ever been to an ophthalmologist, you would have definitely rather seen it. Okay, so basically there is this paper or a board, and there are these letters written on it, English alphabet, or there might be signs on it depending on what the Snellen's chart looks like. And the main key defining feature of this chart is that from top to bottom, the different letters that are written, they keep decreasing in size. I think now you can understand what I'm saying. You must have seen this. So this is basically what a Snellen's chart looks like. Now, beside each row, there is a number written. Okay, beside each row, there is a number written. So basically, in the last row, it will be written 6, then 12, 18, 24, 36, 60. This is how it is written. Basically, what this means is that, let me explain what 3/60 means. 3/60 on the Snellen's chart means that whatever this patient is able to see from 3 meters away, a normal person would be able to see from 60 meters away. That is at best the patient's visual acuity or visual power. That means the patient has pretty poor eyesight. That's what it is meaning very roughly. But what it means quantitatively, it means that what the patient can see at best at 3 meters, a normal person can see 60 meters away. Okay, so people with poor eyesight, you may have often seen this. People with poor eyesight, they tend to get closer to the text that they are reading. Why is that? Because they have poor eyesight. So that is basically what's going on. Anyways, I'm wasting time over here. This is basically what the definition for blindness is, and I just wanted you to know, or rather get familiarized with the terms like loss of vision, blindness, and visual impairment, and all of these stuff, because we'll be dealing with this regularly when we'll talk about the pathologies. So, having talked about that, let's now quickly divert our attention to the risk factors for cataract. So now we know what cataract is, basically. Lens is a transparent structure. So was cornea. If a transparent structure becomes crowded, or rather clouded, not crowded, clouded, okay, that is, it loses its transparency, the light will obviously be hampered. Light flow, light rays will not be able to get in. So that is how the visual impairment develops. Pretty easy to understand. Now, why exactly is this pathology developing? Why exactly is the lens becoming clouded? Why is the lens getting opacified? So there are many risk factors for cataract development. The first one that I mentioned when I was opening this video was increasing age. In fact, the opening statement for my discussion was that age is the most important factor, risk factor for cataract. Okay. Secondly, sunlight. Sunlight proves to be a very important risk factor for many ophthalmological pathologies. We'll see to this later. One of the most important pathologies that sunlight is a risk factor for is cataract. In fact, the UVA and UVB, these are the most important risk factors. Now, thirdly, it has been found out that vitamins A, C, and E, their deficiency leads to cataract. Now, this is important. I had mentioned to you that in my previous video that lens is a low oxygen medium, and for this low oxygen content to be present, there are different antioxidant mechanisms present in the lens. So antioxidant mechanisms present in the lens, the most important antioxidants, or rather a few of the most important antioxidants, are vitamins C and vitamin E. Vitamin A is also an antioxidant, but is not present in the lens. But anyways, the deficiency of these antioxidants means that the lens will not be able to function properly, and hence cataract may develop. Fourthly, and we'll see to this in a lot more detail, diabetes mellitus. Then smoking has been found to be associated with cataract as well. Okay, steroids. It has been found out that patients on corticosteroids, especially for we give steroids for many inflammatory conditions in the eye as well. So patients on long-term steroid therapy have risk of developing cataract. Very, very important. And lastly, another important thing, genetics. Genetics comes more into play when we'll talk about congenital cataract and as such, but this is also a very important risk factor for cataract. Done? Done. Now, let's move on and classify cataract. So what exactly are the types of cataract? Cataract means opacification of lens or its capsule. Okay. What are the types of cataract? So types of cataract, we are actually dividing the types of cataract based on a very easy thing. That is, when exactly are you getting that cataract? That is how we are dividing it. Acquired and congenital. Congenital. Okay. So congenital cataract means that you have faulty genetics to blame. It is not due to any other risk factor, any environmental factor as such. It is due to congenital means what? Developmental problem, right? That is the meaning of any congenital defect means what? Congenital does not mean from birth. Now, this is another very, very important thing. I get sidetracked a lot, but that's because I'm very passionate about dealing with these small things, because often people make mistakes about this. Congenital, often people mistake congenital or rather think that it is synonymous with since birth. So let me quickly write this. Okay, let me quickly give you this small footnote. So congenital does not actually mean since birth. It does not. Okay, there are many conditions which are congenital, but they are not present directly from birth. They take some time to develop. They may develop 2 months after birth. They may develop 1 year after birth. They develop more than 1 year after birth. And as such, we'll see to these conditions in different sections of, in different subjects rather. So anyways, congenital rather means any pathology which is arising due to a developmental defect. A developmental defect. That is it. Developmental defect means development of what? Development of the fetus, development of the embryo. That is during the gestational period of the fetus, of the embryo, when organogenesis is taking place. That is in there, due to some mutation maybe, some developmental defect is taking place. And that developing into a pathology later is known as a congenital defect. Okay. So we'll talk about this in a lot more detail. There are different, there is nothing actually to talk about. There are different multitude of congenital conditions that we'll talk about throughout the entire, I would say, medical studies in ophthalmology as well. So I'm just giving you a brief footnote here. A mental note that you should make over here is that congenital does not mean since birth. Congenital means developmental defect. Okay. Now, with this knowledge at our disposal, let's go back to the classification and you will see how this knowledge becomes applicable right now. Congenital cataract can be of two types. Now see how this knowledge comes into play. Congenital cataract can be developmental or it can be infantile. So, infantile or developmental. Infantile congenital cataract is when the cataract is developing within an year after birth. So the baby's age is less than 1 year. Whereas when it is more than 1 year, It is called developmental. So now see, if congenital had meant since birth, then this classification would not have made any sense. This classification would not have made any sense, developmental and infantile, because I'm clearly saying the developmental cataract takes place after the baby has attained 1 year of age. So definitely it's not since birth, right? That is why the definition for congenital is very important to understand. Now, we are much more important, or rather interested, in the acquired forms of cataract. Acquired forms of cataract are the forms of cataract that we are acquiring due to some pathology, due to some environmental factors, due to some risk factors throughout our lifetime. Acquired cataract can be, now this is the classification that you should really put your attention towards: metabolic, traumatic, complicated, and last but not the least, senile or age related. Age related. So it is pretty self-explanatory. Metabolic cataract, traumatic cataract, complicated, and senile or age related cataract. Metabolic cataract, what does this mean? Let's now talk about these individual things. So metabolic cataract. So what exactly does metabolic cataract means? Metabolic cataract simply means that any form of cataract which is developing due to some metabolic defect, error. What I mean by that will be exemplified, or rather you will understand this better with the different examples that I'm about to put in front of you. That is the different forms of metabolic cataract. So what exactly are we studying? Let me give you a quick highlight. We are studying cataract. Under that we are studying the acquired forms of cataract first, and under that we are studying the metabolic forms of acquired cataract first. What exactly are these metabolic cataracts? Metabolic cataract means opacification in the lens is developing due to some metabolic problem. Metabolism means what? Metabolism means we are dealing with all those carbohydrates, proteins, fats, and the different metabolic pathways that they go through. There is some problem in that, and due to that metabolites are accumulating within the lens, and that is leading to opacification. This is very roughly speaking what metabolic cataract means. Now let's get into the nitty-gritty of this, starting with the most important metabolic cataract, that is due to diabetes mellitus. Diabetes mellitus, obviously you all know what diabetes mellitus is. Condition where we are getting hyperglycemia, that is increased blood sugar, can be due to insulin resistance. We'll see to this in medicine. Actually, this is not exactly, we are not talking about diabetes mellitus in this video. We are talking about the cataract that we get in a person with diabetes mellitus. Okay. So diabetes mellitus means the person has increased blood sugars. Very simple. Now, diabetes mellitus, very interestingly, it causes a host of different ophthalmology problems, eye problems. The first thing that we talk about is the cataract. That is a very characteristic form of cataract called snowflake cataract. So what did I just say right now? I am saying that diabetes mellitus causes a host of problems throughout the body. We are not talking about the body. We are only concentrating on the eye. Okay. In the eye, what are the problems that it causes? In the eye, it causes, first of all, a very interesting form of cataract called snowflake cataract. What does this mean? What exactly is this cataract? We'll see in the subsequent slide. But first, let's complete this list over here. What other problem does it causes? Well, it causes another form of cataract, which is called presenile cataract. Presenile cataract. So we, during our classification, have talked about, or rather just mentioned, a cataract known as senile cataract. What exactly does senile mean? I've already written it down. Senile means age related. So old age. A person is going senile. That is, he's getting old. Actually, senile means a little more than just getting old. He's also senile. Often also, I think in the English dictionary, it often also means somebody is getting a little crazy due to old age, but we are not getting into the nitty-gritty of this. Basically, senile in this perspective means getting old. Okay, so what does pre-senile mean? Pre-senile, before senile. Pre means before. So before senile means that if you call someone senile when that person is at or above 60 years of age, pre-senile means at about 50 years, or rather before 50 years of age, the cataract that develops. The cataract that develops before 50 years of age, but it is due to age-related problems. Due to age-related problems, the pathology is that increased age. So basically this cataract is exactly like senile cataract, except it is happening in a pre-senile person, that is in less than 50 years of age person. Basically what I'm trying to say is increased age is a risk factor for cataract, but that age should be above 50, 60, like this. But if the same kind of cataract that one person gets for being old, a person gets when he or she is 30 years of age, then you call that cataract to be senile, or rather pre-senile. Okay, so basically the pathology is age, but the age hasn't actually been reached. Senile age hasn't actually been reached, but you have got the cataract. So that is a pre-senile cataract. And diabetes mellitus has been found to be an important risk factor for pre-senile cataract. Okay. Now the other pathologies. So these two are cataracts. So these are both opacification of lens. What other structures in the eye does diabetes mellitus affect? Basically, you might get something called a fluctuating refractive error. Fluctuative refractive errors. What does this mean? This means that I have a power of -1 in my eye. My diabetes mellitus, I'm also a patient of diabetes mellitus. Okay. Next month, suddenly, my power goes and becomes -3. Next month, it becomes -2. So fluctuating, my power, it is fluctuating. My power as in the power of my eyes. That is a refractive power. So basically, due to unstable blood glucose levels in diabetes mellitus, we have fluctuating refractive errors. This is another problem. And another very, very important problem that we will study when we talk about retina, very, very important, diabetic retinopathy. Diabetic retinopathy. As the name suggests, it's the pathology of the retina, and retina is a very, very interesting topic. So we'll study this pathology when we'll talk about retina. Now, since we are talking about cataract, let's study this cataract in a little bit more detail. The snowflake cataract, which is the most common cataract that diabetes mellitus causes. So you can see over here there is a picture. Before we deal with the picture, let's first get a few stuff out of our way about snowflake cataract. First, snowflake cataract, this is basically a cortical cataract. What does this mean? To understand what this means, you have to understand what the anatomy of the lens is like. Okay, so I'm hoping that you know what the anatomy of the lens is, or how the anatomy of the lens works. You can go back and watch my previous video on this. But basically, if I go back to this layers of the lens, then you can see that over here you have, this is over here the cortex, and all of this is the nucleus. Okay, and this over here, this dotted thing, this dotted thing is the cortex. Okay, so cortex is a part of the lens. Basically, I'm not going into the details. Remember, actually, this anatomy of the lens, the different layers of the lens, you'll have to understand this very, 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 very important for this discussion, because we'll talk about the different types of cataract, and we'll talk about where they affect the lens at. So for example, I just said that snowflake cataract, which is the cataract caused by diabetes mellitus, is affecting the cortex. So it is a cortical cataract. Okay, it affects the cortex. So we'll refer to that picture again later, but for now, basically this is a cortical cataract. Now, what else? Second thing is that this is the most common type of cataract in type 1 diabetes mellitus patients. Type 1 diabetes mellitus is basically young aged people, whereas the pre-senile cataract, it was in more older people, that is lesser than 50 years of age. So they are basically older, and that is why they are found more in the type 2 diabetes mellitus. Type 2 diabetes mellitus patients, this is more common. Okay, what is type 1, what is type 2? We'll study this in medicine. Okay, just know this for now, that type 1 is diabetes mellitus in the young population, type 2 is basically in the older population, for now, just very roughly. So snowflake cataract is seen in the type 1 diabetes mellitus patients. What exactly and why exactly is this called snowflake? This is called snowflake because, as you can see, and this is where the picture comes into play, you can see that in the center of the eye, I can see this white opacification over here, right? This white opacification, right? And if you look at the opacification carefully, you will see that it is looking like there are white different opacifications scattered all around the lens, all around the center of the eye, and it is looking as if there is, or rather there has been snowfall. There has been snowfall. They look like snowflakes. So that is why this cataract is called snowflake cataract. So this is the type of cataract that diabetes mellitus causes. Okay, so it looks like a snowflake, that is why it is called snowflake cataract. Done? Done. Now, the next metabolic cataract that we talk about is a condition called galactosemia. What exactly is galactosemia? First, let's talk about what galactosemia is as a condition. Although we'll talk about this in detail, we'll talk about this in biochemistry, but right now, just a working knowledge. So galactosemia, this is actually what we call to be an inborn error of metabolism. There is a host of developmental defects, or rather metabolic errors, that take place, and this is a huge topic in biochemistry. Basically what happens is galactose is supposed to be converted to glucose, which is the prime substrate in our body for energy, and there are a host of enzymes over here. What enzymes and all that, we'll talk about this in a bit. But basically, due to the deficiency of these enzymes, due to a mutation in their genes, this conversion is not able to take place, and what is going to happen is galactose is going to accumulate. Now galactose, as well as its metabolites, it has some other metabolites like galactitol, or another name for galactitol is dulcitol. So galactose and its metabolite galactitol or dulcitol, whatever you want to call it, these start accumulating. They will start accumulating in the lens, and basically this is what will lead to opacification and hence galactosemia. This is the condition. This is actually basically what galactosemia is, and this is what, or rather how, galactosemia causes cataract. Okay, now let's get into the nitty-gritty of this. So what exactly, first of all, what are the enzymes which are deficient? Let's talk about the different enzymes. Let me use a different ink over here. The enzymes deficient, let's make a list. There are 3 enzymes, very, very important. First one, Gal1 put. What is this? Gal1 put. Basically, this stands for galactose 1 phosphate uridyl transferase. Okay, I'll just zoom in so that you can take a closer look at my bad handwriting. Don't know if this makes any difference. Galactose 1 phosphate uridyl transferase. Galactose 1 phosphate uridyl transferase. This is the name of the enzyme. This is one of the enzymes. Second enzyme, UDP galactose 4 epimerase. These are just the names of the enzymes. There is nothing to really understand over here. UDP galactose 4 epimerase. This is the name of the other enzyme. Basically, this or this or this. So there is an or in between each of these enzymes. All of these enzymes are not deficient together, either or. Okay. Last one, pretty simple, galactokinase. So any one of these enzymes can be deficient and will get galactosemia. But there is a classical difference over here. See, if either of A or B, they are deficient, that is GAL1 put or UDP galactose 4 epimerase, if these two are deficient or any one of these are deficient, then we get what we call to be classical galactosemia. So if A or B, if they are deficient, then we get what we call to be classical galactosemia. What does this mean? This basically means that over here galactosemia is not a condition of the eye just, right? Galactosemia is an overall condition, just like diabetes mellitus was not a condition of the eye, or just the eye rather. Diabetes mellitus is a condition of the entire body, which is affecting the entire body. There are a host of problems that diabetes mellitus causes. Just like that, galactosemia also is a condition which affects a host of other systems within our body. We are only concentrating on the eye. Classical galactosemia is basically if A or B is deficient, A being this enzyme, B being this enzyme. Now, in classical galactosemia, you get a triad. What is that triad? Basically, in classical galactosemia, you will get mental retardation along with hepatomegaly, and failure to thrive. So another thing that I forgot to mention is that galactosemia is a condition of infants. Okay, this is a condition of infancy. This is not a condition that affects adults as such. Okay, since as the name suggests, this is an inborn error of metabolism. Inborn error of metabolism. That is, you're born and you have this problem. You cannot acquire a mutation within your lifetime which makes any of these enzymes deficient, and hence you get this condition galactosemia. No, you're born with this condition. That is why galactosemia is a condition that you will find in infants. Infants meaning babies less than 1 year. Anyways, so you will get what we call to be this classical pediatric terms like mental retardation or failure to thrive. Failure to thrive is a classical pediatric term. Means that the baby is unable to live properly, grow properly. There is a host of problems within the baby. Mental retardation, pretty self-explanatory. Hepatomegaly, liver enlarges, as well as the cataract that we see in classical galactosemia or even just galactosemia. What is just galactosemia? Just galactosemia basically means, I'm just saying it is just galactosemia, it is not that. Basically the other form of galactosemia, that is when C is deficient, that is galactokinase is deficient. C over here is galactokinase, as you can see. If galactokinase is deficient, then we get only cataract, only the galactosemia cataract. That is it, not all these things, mental retardation, hepatomegaly, failure to thrive, all of this we don't get it. Okay, done. Now, what exactly is a cataract like? So what exactly is this picture like? Why is the eye over here red? The eye over here is not red due to blood accumulating in the eye. Rather, the pupil, as you can see over here, it is dilated. So basically this is over here, we'll talk about this later, but basically this is a test of the eye called red fundal glow. Red fundal glow. We'll talk about this later when we talk about retina, but basically red light is being shown or rather thrown, and that is reflecting against retina, and retina is what? The vascular layer of the eye? Or not exactly, not the vascular, it is the neurosensory layer of the eye, I'm sorry. Neurosensory layer of the eye, and basically the vascular layer is what? The middle layer of the eye. So The middle layer of the eye being vascular, what it is going to do is, against this light that is thrown, being vascular, having a lot of blood vessels, it will reflect off red light, and basically that is how the red fundal glow is achieved. Okay, if you didn't understand it completely, or rather properly, just remember this for now, that red fundal glow is a way of examining the eye. Okay, now against red fundal glow, so that is the only way that you will be able to appreciate this form of cataract that develops in galactosemia. Against the red fundal glow, you will see a very characteristic, if I just zoom in, you will see this very characteristic, as you can see, I'm outlining. This characteristic, now I'll just remove it and you'll see it for yourself. Do you see this? So this characteristic, like an oil droplet, like a central oil droplet like appearance, this is a form of cataract that is developing. So this is basically an opacification. Against the red fundal glow, it looks like a drop of oil has fallen. That is why it is known as oil droplet cataract. So let's quickly go down this slide and write this. The cataract that develops, very, very interesting name for this cataract, an oil droplet cataract. Oil droplet cataract. Okay, so diabetes mellitus, snowflake cataract, galactosemia, oil droplet cataract. Okay, I hope you have understood this entire thing. So this is basically the cataract that we get in galactosemia, and galactosemia in short as a topic. Now let's move on to the next metabolic problem giving rise to a cataract. Pretty simple, myotonic dystrophy. So in myotonic dystrophy, you can see a very characteristic form of cataract. Again, this is known as, very sweet name has been given for this, Christmas tree cataract. Christmas tree cataract. So just for better understanding, I have also put in a picture of a Christmas tree if you haven't seen one, although it's something that I really doubt. Christmas tree, as you can see, it is like this tree, triangular in shape, shining with different lights, right? So just like that, look over here, you will see that there is this outline that I'm making over here with different lights shining in the center. So basically this is a form of cataract. And why are these different forms of light like structures shining here? Basically, this is how we describe this is scattered opacities shining. So scattered shining opacities throughout the lens, but mostly where in the lens? Mostly in the posterior subcapsular area. So this gives us another information that myotonic dystrophy cataract is basically a posterior subcapsular cataract. Now what exactly does this mean? Let's quickly go back to the layers of the lens. Layers of the lens, where are you? Over here you are. So over here, let me quickly erase this so that you can understand. Okay, this should be enough. Now see for yourself and try to find out where we have the capsule of the lens. Where is the capsule of the lens? It's already labeled over here. You can see that the capsule of the lens is this black colored thing that is surrounding the entirety of the lens. So capsule was the only external covering of the lens which is basically continuous throughout, and it is the outer protective covering. So capsule being continuous throughout, it is present more in the anterior, but it is also present in the posterior, although less. So I'm zooming in towards the posterior side of the lens, and you can see over here that the capsule is still present. Where is the capsule over here? I'm just margining it for you. This is the capsule. This black line over here, this is the capsule. Okay, now you understand where the capsule is. Now posterior subcapsule means that it is just below the capsule, over somewhere over here. So it is subcapsule in the posterior region of the capsule, but just below. So it is not exactly in the capsule region, but just over here, somewhere over here, very close to the capsule. This is what posterior subcapsular means. Mark these words, or rather mark this position, very, 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 very important a position this is. Why? Because most cataracts that we'll be studying now, they are posterior subcapsular. That means, what does this term mean, that the cataract is posterior subcapsular? This means that the opacification of the lens through and through, the opacification is not occurring. Rather, a part of the lens is getting opacified. Which part of that is? That is the posterior subcapsular part, where that I have already mentioned to you, shown to you, where in the lens posterior subcapsular part is. This is the posterior subcapsular. Okay. So now that we know what posterior subcapsular is, and now that we are done with myotonic dystrophy, let's move on to the next topic, that is Wilson's disease. So we are still talking about metabolic cataracts. Okay, we still haven't moved on from that, but now we are talking about a separate metabolic problem causing cataract, that is Wilson's disease. Wilson's disease causes a host of eye problems. So not only is Wilson's disease a systemic problem. What is Wilson's disease? Wilson's disease is a disease, we'll talk about this in medicine. Basically, this is a disease that you get for copper accumulation in our body. Okay, roughly speaking, this is it. Now, copper will accumulate in different parts of your body, so it will also accumulate in our lens, and that will lead to problems. That will lead to opacification and will lead to cataract. So the first point about Wilson's disease, as far as its eye manifestations are concerned, is that it causes a very typical kind of cataract called sunflower cataract. Basically, like I just mentioned, due to excess copper in our body, there is deposition not of copper but rather a metabolite of copper, that is cuprous oxide. Cuprous oxide deposition occurs, and this is where it is interesting. In our previous cataracts, we have seen that there is a particular site of the lens that is affected, but cuprous oxide deposition will take place throughout the lens, and it is rather scattered. So there is no single place where you'll find the sunflower cataract. So I cannot say it is posterior subcapsular or it is cortical. I cannot say. It is scattered throughout. Why exactly is it called sunflower cataract? I think it is pretty self-explanatory. So if I just zoom in to this picture, it is pretty self-explanatory why it is called sunflower cataract. You can see like a sunflower. If I just draw with my beautiful sketch of a sunflower, so you can see that it is a stilette shaped kind of a stilette shaped, but don't use the word stilette shaped. Why? Because stilette shaped cataract is, we'll see to this, basically traumatic cataract, blunt trauma cataract, they are stilette shaped. So we don't use the term stilette shaped, we use the term sunflower cataract. It looks like a sunflower. Okay, so you can see over here, if I can just like a sunflower. These are the rays, these are the disc florets. Okay, like this. Okay, ray florets and disc florets. Anyways, so it looks kind of like that. That is why it is called a sunflower cataract. Okay, now this actually is one of the problems that Wilson's disease causes in the eye itself. There are other problems that it causes, and a very well-known problem, actually, very, very well-known problem. This is the problem. So what exactly is the problem over here? A special kind of a ring can be formed. See, what I just said is that copper accumulation in our body, copper is accumulating in different parts of your body, right? Now, one of those parts is the lens, but it is not only accumulating in the lens. In the eye, there are other parts as well. So basically, if the copper starts accumulating, listen very closely, if it starts accumulating in the Descemet's membrane, where is Descemet's membrane present in the eye? It is present in the very good cornea. Basically, Descemet's membrane, periphery of the Descemet membrane in cornea, if that is where the copper oxide or copper accumulates, it forms throughout the cornea a ring-like structure. Very interesting name has been given to this. It is known as the Kaiser Fleischer ring. Let me zoom in. Kaiser Fleischer ring. In short, KF ring. KF ring. So this is a golden brown. I'll show you the picture in a bit. You can already see the picture actually. A golden brown colored ring. A golden brown colored ring. If I just use over here, so this thing, this entire thing, this golden brown thing in the periphery, this basically is the Kaiser Fleischer ring. Now you can appreciate this better. This is in the periphery, a ring-like structure has formed in the cornea. So where exactly is this? This is not the lens. This cannot be the lens. Lens is located somewhere over here, right? So this is basically the cornea, another transparent structure. Now, this is an interesting thing. Why is it an interesting thing? Because as you can see, the Kaiser Fleischer ring is forming in the periphery, but light rays are traveling through here, through the center, through the pupil. They are going into the lens and then they are being refracted onto the retina. So is the formation of a KF ring affecting vision? No. So a KF ring does not affect vision. It does not affect vision. But that does not mean that you should be happy of getting a KF ring. KF ring, even though there is no loss of vision for this, it has been seen that, what did I just say? Wilson's disease, or for this matter, any of the metabolic problems that we have discussed so far, they are not just problems of the eye. We are only concentrating on the problems that they are causing in our eyes, but they are systemic problems. So just like that, Wilson's disease is also a systemic problem because copper is accumulating in different parts of your body, including, very importantly, in the CNS, in our hepatobiliary system. Okay, so in these systems as well, in these organs as well, in these organ systems as well, copper is depositing. So this will lead to what? Neurological problems. Neurological problems. Okay, and hepatobiliary system means there will be hepatic involvement, hepatic symptoms. Okay, now neurological problems. Basically what it has been seen that, and this is why I'm telling you this, if a person develops KF ring, then that person must have neurological manifestations. Neurological manifestation. That means that a person who is suffering from Wilson's disease and the disease has affected his or her central nervous system, more precisely the basal ganglia. The basal ganglia has been affected in that person, then definitely there will be Kaiser Fleischer ring formation in the eyes of that person. Definitely. So if you see KF ring in a person who is suffering from Wilson's disease, that definitely means that that person has some form of neurological manifestations as well. But if you see KF ring in a person, then 100% there is chance of neurological manifestation, but only 50% chance of hepatic involvement. So this is a systemic problem, and as such there are varying degrees of different organ systems being affected, right? So 50% chance of hepatic involvement if Kaiser Fleischer ring is present. Okay. Now another very interesting thing about the KF ring is that let's take another slide over here. Basically, if the KF ring, can you see this? No, you cannot. Okay, I'll just use green, I guess. Okay, so basically, if this is the Kaiser Fleischer ring developing, this is just the KF ring. I'm not drawing any eye or anything around it. This is just the KF ring. This is just the ring. Okay, so this does not develop in a jolt, just like this, immediately, like that. Basically, different parts of the KF ring develop differently. First, there is superior then there is inferior, then laterally. This is how the ring develops. Okay, so first superior, then inferior, then lateral. This is the way that the cave ring will develop. Why is this important? Because as I mentioned, the superior part of the cave ring will appear first. So you're examining the eye of a patient, but you don't examine the eye of the patient very thoroughly. Normally, if you have seen closely, if I can just go back, oh, okay, over here it has been given pretty well. But if I just go back to any picture of an eye, see over here. This is the normal eye. This is the normal eye. This is the canthus of the eye. Canthus means the margin. This over here. This medial border is the canthus. Anyways, so basically what I'm trying to say over here is that normally in our eyes, you cannot visualize the upper 2 millimeters of cornea. You cannot. You cannot visualize the upper 2 millimeters of cornea. Why? Because it is covered over here. Can you see? It is covered by our upper eyelid. So you cannot exactly see the outer margin of the cornea. So you won't be able to appreciate if the cave ring is developing or not, especially because cave ring starts developing superiorly. That is why it is very, very important that if a person is suffering from Wilson's disease, there has been a proper diagnosis of the fact has been made already. Then when you're examining the eye of the person, examine the eye thoroughly. Make sure to lift the upper border of the eye and actually examine the upper border of the cornea, because cave ring formation starts from the upper border superiorly. Okay. So this is the Kaiser-Fleischer ring. Done. Now, another interesting thing is that cave ring being brownish in color, it is difficult to appreciate cave ring in people who have brown colored iris, right? Brown or dark colored iris, it is difficult to appreciate that. So Asian people, Indian people, it will be difficult to appreciate them. But in a light colored iris, often it is easier to appreciate a cave ring. Now, although this will be explained in much more detail when we'll talk about Wilson's disease in medicine, but very shortly we will talk about what the treatment for Wilson's disease is. Wilson's disease means excess copper, so you have to remove copper. Basically, how we remove copper? We use chelating agents. Chelating agents means they will react with the copper, they will bind with it, and they will actually render it useless so that it is not able to form active metabolites and deposit in different parts of the body. And in this way, it will chelate and it will be removed from the body. So the first thing is we use chelating agents. Chelating agents, very, very important names that you'll have to remember, like penicillamine and trientine. For how long has the treatment be continued for? How long is the treatment going to be continued for? The treatment is going to be lifelong. Lifelong treatment with these chelating agents needs to be done. Why lifelong? Because if you stop, the cave ring will reappear. But if you keep on keep this treatment up, then you will see that the cave ring will disappear within 3 to 5 years. Within 3 to 5 years, the cave ring will disappear. Second thing is we have to maintain this. So maintenance therapy. What is maintenance therapy? Maintenance therapy with something called zinc acetate. So zinc acetate, what it will do is this will actually stop the overall absorption of copper. So you not only have a responsibility towards the copper that is already present in your body, you remove that by chelating agents, but you also have to prevent excess copper being absorbed. So for that, maintenance therapy needs to be given with zinc acetate, which will stop the absorption of copper overall. Done. So that basically, that is all about Wilson's disease. Another important thing to know about cave ring, just one last fact about cave ring. cave ring, it has been seen that cave ring is not pathognomic. Not pathognomic for Wilson's disease. How sad is that? So you see someone with a cave ring in their eyes, it is not a 100% chance that that person is suffering from Wilson's disease. So cave ring can be seen in other conditions as well, notably something called primary biliary cholangitis. Primary biliary cholangitis, a condition that we'll talk about in surgery. Second, neonatal hepatitis. So both are conditions affecting the liver, basically the liver or the hepatobiliary system. Primary biliary cholangitis and neonatal hepatitis, these are also conditions where rarely you can see a brownish ring deposition around the Descemet's membrane of the cornea, which is called Kaiser-Fleischer ring. Also very famously seen in Wilson's disease. And Wilson's disease, why did we study Wilson's disease in the first place? Because it forms a particular typical cataract called sunflower cataract. Okay. So that more or less completes our discussion on the metabolic forms of cataract. So metabolic cataracts is done. Now the other forms of cataract, that is traumatic, complicated and senile, we will discuss them in the next video. Okay. In the next video, this video I think already has become a little longer than I expected it to be, but these topics we'll talk about them later in our later video. I hope you have understood all about metabolic cataracts and about cataract in general. Okay, so what is cataract? What are the types of cataract? What are the different forms of cataract? In acquired cataract, in metabolic cataract, what are the different diseases that are forming cataract, and all of that you have understood, hopefully. So this should do this for now. I'll see you again in our next video. For now, farewell. Thank you.